Vaccine experts are saying that their worst fears have come true. And that's because a committee that you may never have heard of, who makes vaccine recommendations for the country, was just fired and replaced with an entirely different group by Health Secretary and vaccine skeptic Robert F. Kennedy Jr. All of the vaccines that you see, whether it's measles or polio or the COVID vaccine or the flu vaccine, go through review by this committee called the Advisory Committee on Immunization Practices, or we call it just ACIP. They look at all of the data, review the evidence, review the safety concerns if there are any, and decide who should get the vaccines when. ACIP may choose to recommend a vaccine or not. When the committee makes a recommendation, insurance companies are now required to cover it. If ACIP doesn't recommend a vaccine, then insurance companies don't have to cover the costs. People might need to pay out of pocket, and the shots can be expensive. The measles shot is up to $250. Polio is a series of 4 shots that could be up to $340. Insurance companies may decide to cover the cost of the vaccine because it's a lot cheaper to offer preventive care than to foot a hospital bill. The most important thing to note here is that our access to vaccines may change completely. A program called the Vaccines for Children program, which provides vaccines to almost half of American kids, would make it possible for kids who can't otherwise afford these vaccines to get them. But without an ACIP recommendation for a vaccine, it could mean that the Vaccines for Children program can no longer carry those vaccines. The other thing that happens is that individual states can decide that the children in that state all need to receive certain vaccines by, say, kindergarten. And those decisions are often very closely based on what the ACIP recommends. If ACIP pulls the recommendation for a vaccine, some states may stop mandating those shots. What we're talking about here is a real patchwork where your access to vaccines may depend on which state you live in, which insurance you have, and which doctor you go see. We may see vaccination rates really drop, and that may mean that we lose herd immunity against important diseases like measles and polio.